My name is Moses Muhumuza Fisher, an orthopedic surgeon at Kosu Hospital in Uganda and the co-lead of Team Etalo. Etalo means bone infection in Uganda, and for our team, it stands for Education to Advance Limb-Saving Options for Osteomyelitis and Open Fractures. Our multidisciplinary team's goal is to improve musculoskeletal health care in Uganda and beyond. Open fractures and osteomyelitis are common and are a source of significant surgical burden and disability, particularly in resource-limited settings. Maria is a 9-year-old girl that presented to our hospital recently with a discharging sinus on her leg. She was admitted to a rural hospital a few months prior with a high fever and painful leg. The medical practitioners there managed her infection with antibiotics and her leg improved some. But since no one did surgery, the infection in her bone was not cleared. Her untreated osteomyelitis worsened and she presented to us with a significant deformity of her leg and was unable to walk. This will negatively impact her life forever. In Uganda and many other resource-limited settings, there is an insufficient access to surgical care for orthopedic problems. The cause of these are multifactorial, with one major factor being the lack of orthopedic surgeons. In many places, medical officers are the first line of defense in treating patients like Maria who present with limb-threatening conditions, and unfortunately they do not have necessary training to provide this care. Drilling human bone is a necessary skill for the management of fractures and infection. Drilling techniques are most commonly taught in orthopedic residency programs. So when medical providers do not undergo this orthopedic training and are confronted with patients at their district or rural hospitals, they are often uncomfortable providing the necessary care. Our own model attempts to solve this gap in training, competence, and confidence. The main audience for our curriculum is medical students, medical officers working in the community, and general surgeons in areas without readily available orthopedic surgeons. Our modules allow learners to work individually or in small learning groups to improve their bone drilling confidence and technique, and with frequent opportunities of self-assessment, repetition, and improvement. Through the GSTC challenge, we began developing a self-guided training course on our Appropedia page called Drill Down, a Guide to Drilling Bone. Our training course includes simple background instructional materials, short educational and card videos that explain step-by-step instructions on building and using the simulator to learn the psychomotor skill of drilling bone. Our simulator is a layered model built by locally available and affordable materials in your community. We offer instructions on how to build 2 different simulators: a simple simulator that focuses just on bone, and a more advanced one that simulates different layers from the bone through to the skin. We present you with a matrix of material options for each layer that can allow the learner to make reference when building their simulator. This range of simulator options can make the learners quickly assemble a simulator and practice the psychomotor skill of drilling bone in a safe environment, with the eventual goal of performing the task safely on humans. Critical to safe bone drilling is the skill to avoid plunging, which is something carefully described in our videos, and so a critical component to our simulator is a layer that we added called the plunge detector. Aluminium foil connected to a circuit that alerts the learner that they have plunged too far into the soft tissues and therefore are prone to damage some of the vital structures. Our simulator and self-guided training materials provide learners with the knowledge, skills, and confidence they need to correctly and confidently care for patients with an open fracture by placing an external fixator, and for those like Maria that have osteomyelitis, a need for a corticotomy. Having more practitioners in low-middle income countries trained in these bone drilling skills will result in more timely and improved care, better outcomes for patients, and less disability around the world.